Okay, so today I'm going to be demonstrating blood administration. So the first thing I would do before going in the room is I would look over my doctor's orders to see what I'm going to be doing today. I'm going to be transfusing 2 units of packed red blood cells. So I'm going to go ahead and gather my supplies, which will be a bag of sodium chloride. So I'm going to look at it, make sure there's nothing floating, the expiration date, and I have 1,000 mils of 0.9 sodium chloride. And then I'm gonna go ahead and grab my tubing. And then I'm gonna go ahead and enter the room. Knock knock. Hi, my name is Cassie. I'm gonna be your nurse today. Can I get your name and date of birth, please? Alright, I'm just going to double check that on the wristband here. I'm going to provide privacy, and I'm going to wash my hands. Alright, Shirley, we're going to be giving you 2 units of packed red blood cells through the IV. Do you have any allergies that I should be aware of? Okay, sounds good, and I see here that you have your consent sign. So basically, I'm gonna go ahead and hang this big bag of fluid and we'll get that going, and then I will call for the blood and we'll go ahead and get the blood running. It will take up to 4 hours. I just want you to know that once we start running the blood, if you feel any dizziness or back pain or just feeling like something's off or shortness of breath, make sure to let me know right away. Alright, if you have any questions at all, just let me know. So I'm going to go ahead and take a look at your IV here. Alright, so I'm going to make sure I have a 20 gauge needle in, just so that the blood can flow quickly and nothing is stopping it and it's the right size. So I'm going to go ahead and check to make sure it's patent. So I have my sodium chloride flush here. I'm going to go ahead and clean. Alright, Shirley, I'm going to go ahead and just flush your IV to make sure it's still in place. If you have any pain or any burning, just make sure to let me know. Alright, so the IV looks good. Looks like it's in the correct spot. So now that I've done that, I'm going to go ahead and hang my sodium chloride and get that running before I call the blood bank. So I'm going to get my tubing. I'm going to make sure that all 3 ends are closed to start with. Alright, and then I'm going to look at my wide tubing and I'm just going to pick whatever side. I'm going to go ahead and insert that in. I'm going to hang it. Once I have that hung, I'm going to go ahead and open my roller clamp, and I'm going to fill this up. Once I have done that, I'm going to go ahead and open the bottom roller clamp. I want to flush the line into the garbage to make sure I get all of the air bubbles out. Alright, now that I have all the air bubbles out, I'm going to go ahead and connect this to the IV. So I'm going to... Alright, Shelly, I'm just going to go ahead and hook you up to just some regular fluids. And then once I get that done, I will go ahead and call the blood bank. So once I have this hooked up, my bottom roller clamp is undone, and I'm going to, and my top one is open just a little bit. We're just running the fluids a little bit. Once I do that, I'm gonna go ahead and just double check that the consent is signed. She doesn't have any questions, so I can go ahead and call the blood bank. While calling the blood bank, I would also call for a second nurse to come in and do the safety checks with me, just so we can do it in a timely manner and I can make sure I have my second nurse and the blood bank, or the blood from the blood bank. All right, so the blood bank delivered the blood. I'm just gonna grab it. All right, I have my blood from the blood bank. I'm gonna make sure that there's nothing floating in it, that it doesn't look unusual in any sort. I have my second nurse here with me. So with the nurse, she'd be holding the blood, I'd be holding the paper. I'd go over patient name, Shirley Cost, her date of birth, patient's ABO and RH, the lot number of the blood, the donor blood in the RH, the expiration date, and then the unit number. Once we did our first round of safety checks, we're gonna go ahead and switch. So with my second nurse, I would go ahead and do that again, the unit number, the lot number, the expiration date, her name and date of birth, her blood type, and the donor's blood type. And then once we have cross-matched twice, it doesn't hurt to maybe do it one more time just to double check that we have the correct blood with the correct patient so that we don't risk anything happening. All right, so once I do that, I'm gonna just go ahead and perform hand hygiene. And I'm gonna put my gloves on. All right, Shirley, how are you feeling? All right, I'm gonna go ahead and hook this blood up here. So like I said, if you feel dizzy, nauseous, sweaty, or just don't feel right, make sure to let me know right away so that we can do what we need to do. All right, so once I have my blood, I've done my multiple safety checks. I've observed the blood, everything looks good. I'm gonna go ahead and remove that. And I'm now going to spike the blood bag. And I am going to hang it. I'm gonna make sure the roller clamp stays closed because I'm gonna get a set of vitals on Shirley to have a baseline. So I would do the full set of vitals, pulse, respirations, blood pressure, and temp, just to make sure that we have a good baseline, so if anything goes wrong, we have something to compare to. So I've taken all of her vitals, everything looks good. So now I can come back over here. I'm going to close my saline, and I'm going to open up my blood. I'm gonna open up the blood clamp all the way because I want it to run. I want it to get through the tubing right to the IV site. All right, so once I see the blood is right to the IV site, I'm gonna go ahead and I'm gonna slow the roller clamp down to 125 mils an hour, just for the first 15 minutes to make sure that she tolerates it well. Great. So once that is done, I'm gonna sit with the client for 15 minutes because I wanna make sure she doesn't have any adverse reactions. Again, letting her know if you have any dizziness, short of breath, sweating, feelings of doom, or just an off feeling, please make sure to let me know so we can take care of that. So the first 15 minutes is up, so I'm gonna go ahead and take another set of vitals, pulse, respiration, temp, and blood pressure. Her 15-minute vitals look good. Everything is running good. So I'm gonna go ahead and just let her know. I'm gonna put the bed in low position, put the call light in place, let her know I'll be frequently checking up on her. After the 15 minutes is up, before I left the room, I would open the blood roller clamp all of the way so that the blood could just quickly finish the 4 hours. So just let her know if she needs anything to let me know. If she feels any type of way, to let me know. I would frequently check on her. All right, so 4 hours later, I came back. The blood is done running. So I can go ahead and shut the blood clamp off. And I'm going to open up my sodium chloride clamp to flush the line so all of the blood can get out of the line. Again, I'm going to take our ending vital signs. So again, I would take her pulse, respirations, temp, and blood pressure, just to make sure her ending vitals looks good. So once I do that and the line is flushed, I'm going to go ahead and put gloves back on. All right, Shirley, everything looks good. All the blood went through really well. So I'm just, like I said, the blood is all moved through the line, so I'm gonna go ahead and close all of my roller clamps once again. I'm gonna unhook my line from the IV, and then just clean the end off just to be safe, and then I would put a cap on it or hook it back up to something else that was hooked up. I would take my tubing and my bags off the line and dispose of both of these per facility policy. So once I've disposed of those, I'll clean up my workstation. I'm gonna go ahead and remove my gloves, perform hand hygiene. All right, Shirley, we're all done with that. So I'm gonna put your bed down in low position. Here's your call light if you need anything. I'll be back to check up on you in a little bit. If you need anything, let me know. Perform hand hygiene. I would leave the room, and then I would go document everything, the date and time, how much blood and sodium chloride I used, the site of where I gave it, if she had any symptoms, how she tolerated it, and then the information on the blood, like the lot number, and stuff like that. So all of that, along with all the 3 sets of vital signs and anything that was taken or observed subjectively or objectively throughout the 4 hours of blood.